Nusa Tenggara Timur Malaria Report 2021. Number of malaria cases in the last 3 years is fluctuating. In 2019, it was 12,909 cases, and then in 2020, it increased to 15,341 cases, and in 2021, it went down to 9,419 cases. Most cases are found in the beginning and in the end of the year. In 2019, there were 528 health facilities provided malaria screening. With 5.3 million total population, annual parasite incidence for Nusa Tenggara Timur was 2.43, categorized as moderate endemicity level. 3 high endemicity areas, 4 moderate endemicity areas, and 15 regencies with low malaria endemicity level. Now we look at the map of 2020. With 531 health facilities provided malaria screening and 5.3 million total population, annual parasite incidence for Nusa Tenggara Timur was 2.88 or moderate endemicity level. 3 regencies were signed as free malaria zones. They are Kota Kupang, Manggarai, and Manggarai Timur. 14 low and 2 moderate, and still 3 red endemicity areas. 2 people confirmed died of malaria from Sumba Timur and Kupang. In 2021, there were 524 health facilities provided malaria screening. With 5.4 million total population, annual parasite incidence 1.72 in Nusa Tenggara Timur, still categorized as moderate endemicity level. Ngada and Ende now become free malaria zones. 14 regencies are low and 3 high endemicity areas. 10 people confirmed died of malaria, 8 from Sumba Barat Daya, 1 case from Sumba Timur, and another one from Flores Timur. 3 regencies declared as malaria-free zones in 2020 and 2 regencies in 2021. Therefore, there are 5 regions with no local transmission of malaria in Nusa Tenggara Timur. Total villages in 2021 were 3,353. 86% of the villages had no confirmed malaria cases. 8% of the villages had 1 to 5 cases in each village. 6 to 10 cases or yellow color in the map were found in 2% of the villages. More than 10 cases were found in 3% of the villages. 44% of malaria cases in Nusa Tenggara Timur were found in females and 56% in males. By age, according to SISMAL age classification, there were 46% of malaria cases were 16 to 64 years old, 20% were 10 to 14, 18% were 5 to 9 years old, 13% were children under 5, 2% above 64 years old, and 1% were babies. National target for positivity rate is below 5%. In 2021, Sumba Barat and Sumba Barat Daya had a high percentage of positivity rate, followed by Sumba Timur with 4.3%, and the rest were less than 1%. Malaria Diagnostic, Treatment, Surveillance, and Vector Control in Nusa Tenggara Timur 2021. The gold standard of malaria diagnostic is by using microscope. Beside that, we use Rapid Diagnostic Test or RDT. Rapid Diagnostic Tests mostly used for screening outside the health facilities like mass blood survey and home visit by community volunteers or Juru Malaria Desa. In 2021, 67% of malaria was found by using microscope, while 33% using RDT. Malaria parasite. Falciparum plasmodium was found in 59% of malaria cases, 29% of 5X, 3% of malariae, and 9% of mixed falciparum with 5X. Malaria diagnostic by microscope. There are 338,901 slides diagnosed by microscope in 2021. 332,123 or 98% slides with negative result and 2% with positive result. Ngada reached 100% as all kind of malaria screening was using microscope. Malaria diagnostic by rapid diagnostic test. There were 163,897 slides diagnosed by RDT in 2021. 161,145 or 98% slides with negative result and 2% with positive result. The highest RDT usage, or 73% of malaria screening, is from Saburajua. Type of malaria diagnostic by Regency. Every malaria case was laboratory confirmed. The three highest percentage of positive slides by microscope were from Sumba Barat, Sumba Barat Daya, and Sumba Timur. Meanwhile, the two highest percentage of positive slides by RDT were from Sumba Timur and Sumba Barat Daya. Percentage of health facilities provide microscopic diagnosis and cross-check in Nusa Tenggara Timur 2021. Every health facility in Saburajua did a cross-check on malaria slides found in each working area. The Puskesmas sent their slides to cross-check at the Regency and all provincial level. In other regencies, for example Sika, 97% of 31 health facilities reported in Sismol that they did microscopic diagnosis, and from all of them, which reported microscopic diagnosis, did cross-check on their slides. 5 regencies did not report any cross-check activities in their areas. Training for microscopists. For strengthening the capacity, microscopists from Puskesmas in high malaria endemicity areas were trained at Provincial Health Laboratory in Kupang. 4 cohorts, each with 18 to 20 trainees. It was challenging during COVID-19 pandemic. 20% of each cohort was online. Competency test for regional cross-checker. Cross-checker from 22 regencies in Nusa Tenggara Timur were assessed by PATELKI, Indonesian Medical Laboratory Technologists Association. There were 4 levels of competency as a result of the test. Cross-checker from NDE reached level A, 5 cross-checker got level B, 7 cross-checker with level C, and 8 other on level D. Type of malaria screening in Nusa Tenggara Timur. As you can see here, there were 8 types of malaria screening. Mass blood survey contributed 47%. There are various types of malaria screening in each regency. Kota Kupang had mostly screening at health facilities and among pregnant women, while other regencies, for example Belu, mostly did mass blood survey. Type of malaria case detection. Looking back at malaria case detection in 2020, Flores Timur was the highest in active case detection. The positivity rate was the highest in Sumba Barat Daya. In 2021, Sumba Tengah reached 88% of active case detection. The positivity rate was highest in Sumba Barat. Training for Juru Malaria Desa. Home visit for malaria screening were mostly delivered by Juru Malaria Desa. In Sumba, there were 327 volunteers trained by Perdaki and Malaria Program Manager to do follow-up on malaria patient, malaria screening using RDT, and coordination with Malaria Program Manager at Puskesmas to give anti-malaria tablets. Distribution of anti-malaria. Total distribution of anti-malaria in Nusa Tenggara Timur can be seen in this map. Malaria standard medication. Standard medication for malaria means giving the patient a proper dosage of dihydroartemisinin and piperquine and primaquine. 11 regencies reach 100% of standard malaria medication. The lowest percentage is from Lembata. Pokja Tata Laksana. To minimize error that might occur during malaria treatment, teamwork has been established, especially in high malaria endemicity areas. It is not just health workers and health professional organizations which are involved, but also the head of district, local bankers, and non-government organizations. There were also orientation sessions for midwives from 4 agencies in Sumba. These sessions aim to integrate malaria data between maternal health and malaria programs, including insecticidal nets distribution for mothers and children. In 2021, the highest rate of screening in pregnant women was in Timor Tengah Selatan. Malaria cases were found in 10 regencies, mostly from Sumba Barat Daya. The highest rate of malaria screening among children under 5 in 2021 was also found in Timor Tengah Selatan. Malaria cases in children under 5 were found in 13 regencies. The highest number of it was from Sumba Barat Daya. Epidemiological investigation is conducted on the first day a malaria case is found. In Indonesia, we have 1-2-5 approach epidemiological investigation. On the first day, there is notification, followed by investigation on day 2 to 4 to classify the origin of the case, and day 5 for the case management, like mapping the focus area. This activity is prioritized in elimination and low malaria endemicity area. In 2021, 6 regencies did the investigation for all malaria cases found in their area. Meanwhile, 3 regencies did not conduct it at all. Mapping receptivity is to determine if the water area has Anopheles larva or mosquito. In Manggarai, 88% of villages were already identified, and 70% of the villages were receptive or Anopheles was found in the village. In Samudra Jua and Sumba Barat, there were no report of receptivity mapping. Entomology training was held on Sumba Island, and all malaria program managers were trained to understand about larvae and mosquito, especially Anopheles. The training was also facilitated by entomologists from local Bankes, Waikabuba. Long-lasting insecticidal nets distribution reported in Sismal in 2021 for Sumba Barat Daya were 69%, Sumba Barat and Sumba Tengah 50%, Sumba Timur 46%, and Lembata 25%. The rest will be distributed in early 2022. To support malaria prevention and control in Nusa Tenggara Timur, there was the Governance Ordinance No. 11 of 2017 about malaria elimination, followed by regulation in regency level. There were 12 regencies already have their regulation on malaria elimination until 2021. Thank you.